Welcome to BoxedIn Health. Today we uncover the topic of dengue fever. Dengue fever is a disease transmitted by mosquitoes, typically found in tropical and subtropical regions globally. A milder form of the illness leads to a high fever and symptoms resembling the flu. On the other hand, severe dengue fever, known as dengue hemorrhagic fever, can result in severe bleeding, a sudden decline in blood pressure, shock, and even death. Every year, millions of cases of dengue infection are reported worldwide. Dengue fever is most prevalent in Southeast Asia, the Western Pacific Islands, Latin America, and Africa. Nevertheless, the disease is spreading to new regions, including localized outbreaks in Europe and southern parts of the United States. Efforts are underway to develop vaccines against dengue fever. At present, in regions where dengue fever is prevalent, the most effective preventive measures involve avoiding mosquito bites and implementing strategies to reduce the mosquito population. Many individuals may have a dengue infection without displaying any noticeable symptoms. When symptoms do manifest, they can be easily confused with other illnesses, such as the flu, and typically manifest between 4 to 10 days after being bitten by an infected mosquito. Dengue fever is characterized by a high fever, reaching 104 F, 40 C, accompanied by a combination of the following signs and symptoms: headache, muscle, bone, or joint pain, nausea, vomiting, pain behind the eyes, swollen glands, rash. Most individuals recover within approximately a week. However, in certain cases, the symptoms worsen and can progress to a life-threatening stage known as severe dengue, dengue hemorrhagic fever, or dengue shock syndrome. Severe dengue occurs when the blood vessels sustain damage and start leaking, and the count of clot-forming cells, platelets, in the bloodstream decreases. This can lead to shock, internal bleeding, organ failure, and even fatality. Warning signs of severe dengue fever, constituting a life-threatening emergency, may manifest rapidly. Typically, these warning signs emerge within the first day or two after the fever subsides and may include severe stomach pain, persistent vomiting, bleeding from gums or nose, blood in urine, stools, or vomit, bleeding under the skin, resembling bruising, difficulty or rapid breathing, fatigue, irritability or restlessness. If you've been in an area where dengue fever is prevalent, experienced a fever, and notice any warning signs like severe stomach pain, vomiting, breathing difficulties, or any signs of bleeding, nose, gums, vomit, or stools, it's crucial to seek immediate medical help. In case you've recently traveled and are running a fever with mild symptoms resembling dengue fever, reach out to your doctor for guidance. Dengue fever is a result of infection by any of the 4 distinct types of dengue viruses. It's important to note that being in close proximity to an infected individual does not transmit the disease. Rather, dengue fever is transmitted through mosquito bites. The 2 types of mosquitoes that primarily carry and spread the dengue viruses are commonly found in and around human habitats. When a mosquito bites a person who is already infected with a dengue virus, the virus is transmitted to the mosquito. Subsequently, when this infected mosquito bites another person, the virus is introduced into that individual's bloodstream, causing an infection. Following recovery from dengue fever, you gain immunity specific to the type of virus that initially infected you. However, this immunity does not extend to the other 3 types of dengue fever viruses. Moreover, the risk of developing severe dengue fever escalates with each subsequent infection. Your likelihood of contracting dengue fever or experiencing a severe form of the illness is heightened if you reside in or travel to tropical regions. Living or visiting tropical and subtropical areas raises your chances of coming into contact with the dengue fever-causing virus. Particularly high-risk regions encompass Southeast Asia, the Western Pacific Islands, Latin America, and Africa. Severe dengue fever has the potential to induce internal bleeding and harm organs. It can lead to a perilous drop in blood pressure, resulting in shock. Unfortunately, in certain instances, severe dengue fever can be fatal. Pregnant women who contract dengue fever may pass the virus to their baby during childbirth. Furthermore, babies born to mothers who had dengue fever during pregnancy face an increased likelihood of being born prematurely, having a low birth weight, or experiencing fetal distress. In regions where dengue fever is prevalent, there's an approved dengue fever vaccine called Dengvaxia, designed for individuals aged 9 to 45 who have previously experienced dengue fever. The vaccine involves a 3-dose regimen administered over a 12-month period. The vaccine is specifically sanctioned for individuals with documented dengue fever history or those who have undergone a blood test confirming prior infection with one of the dengue viruses, known as seropositivity. Notably, individuals who haven't encountered dengue fever in the past, seronegative, and receive the vaccine may potentially face an increased risk of severe dengue fever and subsequent hospitalization due to dengue fever. It's essential to emphasize that the World Health Organization underscores the vaccine's insufficiency as a standalone measure to combat dengue fever in areas where the disease is widespread. Key preventative methods still encompass averting mosquito bites and managing mosquito populations to curb the spread of dengue fever. For individuals residing in or traveling to dengue fever-prone regions, adopting the following precautions can help minimize the risk of mosquito bites. Opt for air-conditioned or well-screened accommodations. Dengue-carrying mosquitoes are most active during dawn to dusk and can bite at night as well. Wear protective attire, including long-sleeved shirts, long pants, socks, and closed-toe shoes when entering mosquito-prone areas. Utilize mosquito repellent. Permethrin can be applied to clothing, shoes, camping gear, and bed nets. Additionally, repellents with at least a 10% concentration of DEET should be used on the skin. Dengue-carrying mosquitoes typically breed in and around residences, often in standing water collected in objects like used car tires. Regularly empty and clean containers that hold standing water, such as planters, pet bowls, and flower vases, to help reduce mosquito populations. If you enjoyed today's video, do like, share and subscribe for more informative content. Thanks for watching.